Imagine a scenario where your body's most fundamental energy source suddenly plummets, throwing your entire system into chaos. This isn't a scene from a science fiction movie, it's a stark reality for millions living with diabetes. Hypoglycemia, or critically low blood sugar, is a silent threat that can transform a normal day into a life-threatening emergency in mere moments. It's a condition often misunderstood, sometimes underestimated, but always demands immediate attention. The consequences of ignoring the early warning signs can be devastating, ranging from disorientation and seizures to irreversible brain damage or even death. Understanding this delicate balance is not just vital for those with diabetes, but for anyone who might encounter someone in such a crisis. Diabetes, in its various forms, is a chronic condition characterized by high blood sugar levels. However, paradoxically, the treatments designed to manage this often lead to the opposite extreme, hypoglycemia. It's a delicate tightrope walk, where too much insulin, skipped meals, or intense exercise can tip the scales dramatically. For a person with diabetes, maintaining stable blood glucose levels is a constant, intricate balancing act. This video will demystify these critical emergencies, focusing primarily on hypoglycemia, but also touching upon other urgent diabetic situations, providing you with the knowledge to act decisively and effectively when every second counts. At its core, hypoglycemia is defined as a blood glucose level below 70 mg per deciliter, 3.9 millimoles per liter. While this number serves as a general threshold, individual responses can vary. Some people might start experiencing symptoms at slightly higher levels, while others might not feel the effects until their sugar is even lower. This variability makes it particularly challenging, as symptoms aren't always a perfect indicator of the exact numerical value. The severity is often categorized: mild, moderate, and severe, each requiring a different level of intervention. Understanding these distinctions is crucial for appropriate and timely management, preventing progression to a more critical state. Glucose, a simple sugar, is the primary fuel source for every cell in our body, especially the brain. Without a steady supply, the brain simply cannot function properly. Insulin, a hormone produced by the pancreas, acts like a key, allowing glucose to enter cells from the bloodstream. In people with diabetes, either the body doesn't produce enough insulin, type 1, or it doesn't use insulin effectively, type 2. Medications, particularly insulin injections or certain oral drugs, are administered to lower blood sugar. When these medications work too well, or are given in excess relative to food intake or activity, blood sugar drops precipitously, leading to hypoglycemia. The causes of hypoglycemia are numerous and often interconnected. The most common culprit is an imbalance between insulin, or other glucose-lowering medications, and carbohydrate intake. Taking too much medication, or taking it at the wrong time, can be a major factor. Skipping meals or eating less than planned after taking medication is another frequent cause. Unexpectedly vigorous or prolonged exercise can also deplete glucose stores rapidly, especially if medication doses aren't adjusted. Alcohol consumption can further complicate matters, as the liver prioritizes metabolizing alcohol over releasing stored glucose, increasing the risk of delayed hypoglycemia. All these factors underscore the delicate balance required in diabetes management. Recognizing the signs and symptoms of hypoglycemia is paramount. These can manifest rapidly and vary from person to person. Early, mild symptoms often include shakiness, nervousness, sweating, chills, irritability, confusion, and a rapid heartbeat. You might also feel lightheaded or dizzy, hungry, or notice blurred vision. These are the body's alarm bells, signaling that glucose levels are falling. It's crucial to pay attention to these subtle cues, as they offer the best window for intervention before the situation escalates. Ignoring them can lead to a more severe and dangerous state, making self-treatment impossible. As blood sugar continues to drop, the symptoms become more severe and concerning. Moderate hypoglycemia can lead to difficulty concentrating, slurred speech, clumsy or jerky movements, and even personality changes like irrational behavior or aggression. The individual might appear drunk, leading to dangerous misunderstandings if bystanders aren't aware of their condition. These symptoms indicate significant brain impairment due to lack of glucose. At this stage, self-treatment may still be possible, but assistance from another person often becomes necessary. The urgency intensifies, as every minute counts in restoring the brain's vital fuel supply. Severe hypoglycemia is a medical emergency. At this stage, the person may lose consciousness, have seizures, or fall into a coma. They are unable to treat themselves and require immediate medical intervention. The brain is severely deprived of glucose, and prolonged periods in this state can lead to irreversible damage. This is why awareness and prompt action in the earlier stages are so critical. Family members, friends, and caregivers must be educated on how to recognize and respond to these extreme symptoms, as their quick thinking can be the difference between life and death or permanent disability. The Rule of 15 is a cornerstone of hypoglycemia management for conscious individuals. It's a simple yet highly effective guideline: consume 15 grams of fast-acting carbohydrates, wait 15 minutes, then recheck blood sugar. If blood sugar is still below 70 milligrams per deciliter, repeat the process. This controlled approach prevents overtreatment, which can lead to rebound hyperglycemia. Examples of 15 grams of fast-acting carbs include 4 glucose tablets, 4 ounces, half a cup, of fruit juice or regular soda, not diet, or 1 tablespoon of sugar or honey. It's important to avoid foods high in fat, like chocolate, as fat slows down sugar absorption. After initial treatment with 15 grams of fast-acting carbohydrates, it's vital to follow up. Once blood sugar returns to normal, above 70 milligrams per deciliter, if your next meal is more than an hour away, you should eat a small snack containing both carbohydrates and protein. This helps to stabilize blood sugar and prevent another dip. Examples include a piece of fruit and a small handful of nuts, or a few whole grain crackers with cheese. This step is crucial for sustained glucose levels and ensures the body has a more stable fuel source. Skipping this follow-up snack can leave you vulnerable to another episode, especially after an intense low. For severe hypoglycemia, especially when the person is unconscious or unable to swallow, glucagon becomes the hero. Glucagon is a hormone that counteracts insulin, prompting the liver to release stored glucose into the bloodstream. It's typically administered as an injection or a nasal spray by a trained caregiver. Every person at risk of severe hypoglycemia should have a glucagon emergency kit readily available, and their family members, friends, or colleagues should be instructed on how and when to use it. Knowing how to administer glucagon can be the difference between life and death in a dire situation. After administering glucagon, it's crucial to call emergency services immediately, even if the person appears to recover. Glucagon's effects are temporary, and the underlying cause of the severe low needs to be addressed. Once the person regains consciousness and can safely swallow, offer them fast-acting carbohydrates followed by a longer-acting snack to replenish glucose stores and prevent a relapse. Stay with them and monitor their condition closely until medical professionals arrive. Even a seemingly full recovery warrants professional medical evaluation to prevent recurrence and understand why the severe episode occurred. Prevention is always the best medicine. Meticulous blood glucose monitoring is fundamental, allowing individuals to track patterns and make necessary adjustments. Regular checks before and after meals, before bedtime, and especially before and after exercise, provide invaluable data. Careful meal planning and consistent carbohydrate counting are also critical. Understanding the carbohydrate content of foods and adjusting insulin doses accordingly is an essential skill. Never skip meals, particularly after taking insulin, and always carry fast-acting carbohydrates with you as a safety net. Proactive management significantly reduces the risk of hypoglycemic episodes. Exercise is a double-edged sword for people with diabetes. While highly beneficial for overall health, it can significantly impact blood glucose levels. Physical activity increases glucose uptake by muscles, potentially leading to a drop in blood sugar. It's important to monitor glucose before, during, and after exercise, and to adjust insulin or food intake as needed. Carrying snacks and staying hydrated are crucial. Discussing an exercise plan with a healthcare provider can help tailor strategies to individual needs, preventing unexpected lows and ensuring a safe and effective fitness routine. Always be prepared for potential fluctuations during and after physical exertion. Alcohol consumption can be particularly tricky for people with diabetes. The liver, which normally releases stored glucose to maintain blood sugar, prioritizes metabolizing alcohol. This means its glucose-releasing function is impaired, increasing the risk of delayed hypoglycemia, sometimes hours after drinking. It's crucial to consume alcohol in moderation, if at all, and always with food. Monitoring blood sugar levels closely before, during, and after drinking is paramount. Informing friends or family about your condition when drinking can also be a safety measure, ensuring someone is aware and can assist if an emergency arises. Medical identification is a simple yet incredibly effective safety measure. Wearing a medical alert bracelet or necklace that clearly states diabetic and lists any allergies or emergency contact information can be life-saving. In an emergency, if you are unconscious or disoriented, this identification provides crucial information to first responders. It tells them immediately that you have diabetes, prompting them to check for hypoglycemia or other diabetic emergencies, preventing potentially fatal misdiagnosis. It's a small accessory that carries immense weight in a critical situation, speaking for you when you cannot. Beyond hypoglycemia, other diabetic emergencies require attention. Diabetic ketoacidosis, DKA, is a severe complication primarily of type 1 diabetes, occurring when the body lacks enough insulin to use glucose for energy. Instead, it starts breaking down fat, producing acidic byproducts called ketones. Symptoms include excessive thirst, frequent urination, nausea, vomiting, abdominal pain, fruity-smelling breath, and deep, rapid breathing. DKA is a life-threatening condition requiring immediate medical attention, typically hospitalization for intravenous fluids, insulin, and electrolyte replacement. Recognizing DKA symptoms is as vital as recognizing hypoglycemia. Hyperglycemic hyperosmolar state, HHS, is another serious emergency, more common in type 2 diabetes. It's characterized by extremely high blood sugar levels, often over 600 mg per deciliter, without significant ketone production. Symptoms develop slowly over days or weeks and include severe dehydration, confusion, drowsiness, and potentially seizures or coma. HHS often occurs in older adults with type 2 diabetes, often triggered by an illness, infection, or medication non-compliance. It requires immediate hospitalization for fluids and insulin to gradually lower blood sugar and correct dehydration. Both DKA and HHS underscore the complexity and potential severity of uncontrolled diabetes. Living with diabetes means navigating a constant flow of information and making informed decisions about diet, exercise, and medication. Education is your most powerful tool. Understanding your specific type of diabetes, how your medications work, and how different foods and activities affect your blood sugar levels empowers you to take control. Attend diabetes education classes, consult with your endocrinologist, certified diabetes educator, and dietitian regularly. The more you know, the better equipped you are to prevent emergencies and maintain a high quality of life. Never stop learning about your condition and its management. Continuous glucose monitors, CGMs, have revolutionized diabetes management, offering real-time blood glucose readings without the need for frequent finger pricks. These devices provide trend arrows, indicating whether glucose levels are rising, falling, or stable, allowing for proactive adjustments. CGMs can alert users to impending lows or highs, providing a critical early warning system that significantly reduces the risk of severe episodes. For many, CGMs offer peace of mind and greatly improve blood sugar control, making the tightrope walk of diabetes management a little less precarious. They represent a significant advancement in personal diabetes care. Insulin pumps are another technological marvel. These small, computerized devices deliver a continuous, precise dose of insulin throughout the day and night, mimicking the natural function of a healthy pancreas. Users can also program additional insulin doses for meals or to correct high blood sugar. This continuous delivery, often paired with CGMs, offers unparalleled flexibility and precision in managing blood glucose, dramatically reducing the frequency and severity of both high and low blood sugar events. For many, insulin pumps improve quality of life and significantly reduce the burden of daily injections, offering a path to better control. When faced with a hypoglycemic emergency, knowing when to call for professional medical help is crucial. If the person is unconscious, having a seizure, or unable to swallow, always call emergency services, e.g., 911 in the US, immediately, even if you administer glucagon. If blood sugar remains low despite repeated Rule of 15 treatments, or if symptoms are severe and worsening, it's time to seek medical assistance. Don't hesitate or delay, waiting too long can lead to grave consequences. Trust your instincts and err on the side of caution when in doubt, as prompt medical care can prevent serious complications. For caregivers, family, and friends of individuals with diabetes, your role is indispensable. Learn the signs and symptoms of hypoglycemia, understand the rule of 15, and know how to administer glucagon. Ensure the person you care for always has fast-acting carbohydrates readily available. Be aware of their usual daily routine, medication schedule, and any changes that might increase their risk of a low. Your vigilance, preparedness, and quick thinking can be life-saving. Open communication with the person living with diabetes about their condition and needs fosters a safer environment for everyone involved. Driving with diabetes presents unique challenges, as hypoglycemia can severely impair cognitive function and reaction time. It's critical to check blood sugar before driving and every few hours on long trips. If blood sugar is below 70 mg per deciliter, do not drive. Treat the low, wait 15 minutes, recheck, and ensure it's above 80 to 90 mg/dl before getting behind the wheel. Always carry glucose tablets or other fast-acting carbs in the car. Many countries have specific regulations regarding driving and diabetes. Ensure you are aware of and comply with these to ensure your safety and the safety of others on the road. Traveling across time zones or with changes in routine can disrupt diabetes management and increase the risk of hypoglycemia. Altered meal times, different activity levels, and changes in medication schedules all require careful planning. Consult with your doctor well in advance of any travel to adjust your insulin regimen or oral medications. Always carry your diabetes supplies in your carry-on luggage, and have a medical alert card or letter from your doctor describing your condition. Being prepared and proactive minimizes risks and ensures a safer, more enjoyable travel experience, reducing the chances of an emergency far from home. Nighttime hypoglycemia, or nocturnal hypoglycemia, is a particularly insidious form of low blood sugar because symptoms can be missed while sleeping. Waking up with a headache, night sweats, nightmares, or feeling unusually tired can be indicators. It can also be caused by too much insulin before bed, delayed absorption of dinner, or intense evening exercise. Monitoring blood sugar before bed and understanding your personal patterns are crucial. Basal insulin adjustments or a bedtime snack might be necessary to prevent these dangerous overnight lows, ensuring a restful and safe night's sleep. Recurrent hypoglycemia, or frequent low blood sugar episodes, is a serious concern. It can lead to hypoglycemia unawareness, where the body stops producing the early warning signs like shakiness or sweating. This is extremely dangerous, as the person may go directly into severe hypoglycemia without any prior symptoms. If you experience frequent lows, discuss it urgently with your healthcare provider. Adjustments to medication, meal plans, or lifestyle might be necessary to break this cycle and restore your body's ability to recognize and respond to falling blood sugar levels, protecting you from critical episodes. Medication adherence is a cornerstone of diabetes management. Taking your insulin or oral medications exactly as prescribed by your doctor is essential. Deviating from the schedule, taking incorrect doses, or forgetting doses altogether can significantly increase the risk of both hyperglycemia and hypoglycemia. If you have difficulty remembering your medications, consider using pill organizers, setting alarms, or utilizing smartphone apps designed for medication reminders. Consistent adherence minimizes fluctuations in blood sugar and helps maintain stable levels, preventing emergencies. Your health depends on this consistency and diligence. Stress and illness can profoundly impact blood sugar levels. During times of stress, the body releases hormones that can raise blood glucose. Conversely, illness, particularly if it causes nausea or vomiting, can make it difficult to eat, increasing the risk of hypoglycemia, especially if insulin doses aren't adjusted. It's crucial to have a sick day plan discussed with your doctor, detailing how to manage medications, diet, and monitoring during illness. Regular stress management techniques, like mindfulness or exercise, can also help maintain more stable blood sugars during challenging times. Proper storage of insulin and other diabetes medications is vital for their efficacy. Insulin is sensitive to extreme temperatures. It should be stored in the refrigerator before opening and at room temperature once opened, away from direct sunlight or freezing. Expired or improperly stored insulin can lose its potency, leading to high blood sugar, or in some cases, unexpected fluctuations. Always check expiration dates and follow manufacturer guidelines for storage. This seemingly small detail plays a critical role in ensuring your medications work as intended, contributing to stable blood sugar control and preventing emergencies. The psychological impact of living with diabetes and the constant threat of emergencies cannot be overstated. The fear of hypoglycemia, often called hypoglycemia fear, can lead to anxiety, depression, and even intentional hyperglycemia to avoid lows, which has its own long-term complications. It's crucial to address these emotional aspects. Seeking support from mental health professionals, joining support groups, or talking openly with family and friends can help manage this fear and improve overall well-being. A holistic approach to diabetes care includes mental and emotional health alongside physical management. Research and medical advancements are continuously improving diabetes care. From smarter insulin pumps and more accurate CGMs to new medications that offer better glucose control with fewer side effects, the future is promising. Participating in clinical trials, staying informed about new treatments, and discussing these options with your healthcare provider can open doors to better management strategies. These innovations offer hope for reducing the burden of diabetes and minimizing the risk of emergencies, moving towards a future where living with diabetes is safer and healthier. Ultimately, managing diabetes and preventing emergencies is a partnership between the individual, their healthcare team, and their support network. Regular checkups with your endocrinologist, dietitian, and certified diabetes educator are crucial. Don't hesitate to ask questions, voice concerns, and actively participate in your treatment plan. The goal is to empower you with the knowledge and tools to live a full, healthy life while effectively managing your condition. This collaborative approach ensures that you receive the best possible care and support to navigate the complexities of diabetes. Understanding the nuances of hypoglycemia and other diabetic emergencies is a journey of continuous learning. Each individual's body responds differently, and what works for one person might not work for another. Embrace the learning process, be patient with yourself, and celebrate small victories in blood sugar control. The more you learn and apply, the more confident and capable you become in managing your diabetes, turning potential crises into manageable moments. This ongoing commitment to knowledge and self-care is your greatest defense against the unpredictable nature of blood sugar fluctuations. We've covered a vast array of critical information today, from the fundamental causes and symptoms of hypoglycemia to advanced management strategies and other diabetic emergencies. The overarching message is clear: preparedness and knowledge are life-saving. By understanding the rule of 15, knowing when to use glucagon, maintaining consistent monitoring, and educating those around you, you significantly reduce the risks associated with diabetes. This information isn't just theory, it's a practical toolkit for navigating the daily challenges and ensuring safety. Never underestimate the power of being informed. Share this video with anyone who could benefit, whether they live with diabetes, care for someone who does, or simply want to be prepared to help in an emergency. The more people who understand diabetic emergencies, the safer our communities become. Your ability to act quickly and correctly can profoundly impact someone's life, preventing severe complications or even saving them from a critical situation. Be a lifesaver, arm yourself with knowledge. In closing, remember that diabetes is a manageable condition, but it demands respect and vigilance. Hypoglycemia and other emergencies are serious, yet largely preventable with proper education and proactive management. Continue to engage with your healthcare team, stay updated on advancements, and prioritize your well-being. Thank you for joining us on this vital exploration of diabetic emergencies. May this knowledge empower you to live healthier, safer, and more confidently with or around diabetes. Stay safe, stay informed.